Hello, my name is Sophia Nessa and I'll be doing my project on a medial collateral ligament sprain. So for the anatomy of the knee and the leg, we have the femur, which is the largest bone in the body, the tibia, which is a large lower bone, and meets at the femur to form a hinge joint, the fibula, which articulates at the knee only with the tibia, the patella, which is also known as the kneecap, and the patellar tendon. So the knee has cartilage called meniscus that acts as a shock absorber and helps stabilize the knee. There is a medial meniscus, which is cartilage that lies medially on the tibia, and lateral meniscus, which is cartilage that lies laterally on the tibia. So for ligaments, the knee has 4 major ligaments, 2 cruciate ligaments, and 2 collateral ligaments. The cruciate ligaments are the ACL and the PCL. The collateral ligaments are the MCL, which connects the medial side of the knee from femur to tibia, and the LCL, which connects lateral side of knee from femur to fibula. Collateral ligaments also stabilize knee from side-to-side forces. So the motions of the knee include knee flexion and knee extension. Flexion of the knee is predominantly the result of contracting the hamstring muscles like the biceps femoris, the semitendinosus, and the semimembranosus. The gastrocnemius crosses the knee and assists with knee flexion. Knee extension is primarily performed by the 4 quadriceps muscles, like the vastus medialis, the vastus lateralis, the vastus intermedius, and the rectus femoris. The mechanism of injury describes how, with what force, and to which part of the body the patient was injured. The MOI for an MCL sprain is: MCL is injured when an athlete receives a blow to the outside of the knee. This causes the knee to bend inwards and stresses the MCL. People who play football, hockey, and other sports where players impact other athletes with great force may injure their MCL this way. Another MOI is a twisting injury. And down here, I wasn't able to embed the link, but it shows an MCL sprain. So signs are clear things an athletic trainer can see or measure without needing the description from the athlete. Symptoms are any complaints that the athlete reports to the athletic trainer that cannot be seen. For a mild sprain, the signs are swelling, full knee flexion and extension, and no joint laxity. The symptoms include medial joint line pain. For a moderate sprain, the signs are mild swelling and some joint laxity. The symptoms include some discomfort. For a severe sprain, the signs are moderate or severe amount of swelling, great deal of joint laxity, and loss of function. All possible signs and symptoms include pain on medial aspect of knee, difficulty walking, limited flexion and extension, discomfort, pain or tenderness along the inside of the knee, swelling, and locking or catching of knee joint. So for acute treatment, acute injury is the result of a specific impact or traumatic event that occurs in one specific area of the body, such as a muscle, bone, or joint. The athlete's knee should be treated with prices, which is protection of injured body part with crutches, splints, or mobilizer, rest of injured part, ice, compression, and elevation to decrease swelling, facilitate early range of motion. A mild injury may only require an elastic wrap for compression and support. With a moderate or severe MCL sprain, the knee should be immobilized. So, long-term treatment includes rehabilitation, which is to regain strength in your knee and prevent further injury. It includes exercises to restore strength and normal range of motion to the knee, and strengthening the muscles that cross the medial aspect of the knee. Another form of treatment is taking pain relievers such as aspirin and ibuprofen to ease pain and swelling. So the timeline varies depending on the grade of the sprain. So a minor or grade 1 MCL sprain can take from a few days to a week and a half to heal sufficiently for you to return to normal activities, including sports. A grade 2 sprain can take up to 4 weeks to heal, and a grade 3 sprain usually takes up to 8 weeks to heal unless it is associated with damage to the ACL, in which case the recovery time may be longer. So the first phase in the rehabilitation program is the acute/inflammatory phase, which its goals is to control inflammation and restore mobility. So the first exercise are heel slides. To perform this gentle range of motion, or ROM exercise, the athlete lies on their back on a hard surface. The heel is slowly moved up as far as is comfortable. Socks can be worn to ensure that the foot slides. After a minute or so, further movement may be possible. A towel or a strap wrapped around the ankle can be used to help, although this should not be forced in the early stages or if there is any pain. The second exercises are flexion/extension exercises. The exercise is extremely important not only to improve the mobility of the injured knee, but it will also help maintain the strength of the quadriceps and hamstrings in the early stages of rehabilitation. These movements can also help to decrease the swelling surrounding the knee. Aim to bend and straighten the knee as far as you comfortably can. This can be done in sitting, standing, or lying on your front. Aim for 3 sets of 10 to 20 repetitions 3 times a day as pain allows. This will aid in strengthening the muscles. The third exercise are double leg calf raises. Stand with feet shoulder width apart and close to something to hold onto for balance. Lift your heels up as high as possible off the floor. In the early stages, the exercise must be done with both legs at the same time. Slowly lower back to the floor. Later, this exercise can be progressed by moving to single leg calf raises. And on the side, I have a YouTube video showing this exercise. So for the second phase of this program, there's the intermediate phase, which its goal is to increase proprioception, muscle control, and strength. So for the first exercise, I have wobble board exercises. Wobble boards are most commonly used in the rehabilitation of ankle injuries such as ankle sprains, although they should also be used for other leg and knee injuries. The purpose to challenge your sense of balance, which will force you to train your sense of proprioception. So for the exercises, you stand with both feet and rock the board left to right and front to back and have the edge touch the floor. Roll the board in a circle, touching the edge on the floor. Balance the board trying to keep the edges off the floor as long as you can, or squat lightly. For the second exercise, I have mini squats. Stand with feet just wider than shoulder width and back straight. Squat down halfway to horizontal about 45 degrees and return to standing. Aim for 3 sets of 10 to 20 repetitions during rehabilitation. Progress is exercised by adding weight, increasing the depth of the squat to 90 degrees or near horizontal thighs, or moving to single leg squats. The third exercise I have are bridges. The athlete lies on their back, knees bent, and pushes their hips upwards. Use both feet on the floor, pushing up to begin with. Hold the position briefly and then lower. Progress is exercised to single leg bridges. For the third phase in this rehabilitation program, I have there's a strength training phase, which its goal is to increase muscular strength and endurance to sport levels. For the first exercise, I have full squats and lunges. So for lunges, you start with a wide stance. Bend the back knee towards the floor, but don't let it touch. Keep your back upright throughout, and don't let the front knee move forwards past the toes. So for squats, stand feet shoulder width apart, firmly planted on the ground. Then slowly bend the knees as if sitting back into a chair, keeping the back straight and the abdominals engaged. The knees should not go forward beyond the toes. Arms may be raised forward to help with balance. For the second exercise, I have a leg press. Position yourself on the seat with feet hip width apart on the platform. In the starting position, there should be approximately a 90-degree angle at the knee. Adjust the seat accordingly. Push with the legs to straighten the knees. Either the seat will move backwards or the platform will move forwards. Do not lock the knees, but leave a slight bend. Slowly bend the knees back towards the starting position. For the third exercise, I have a single leg bridge. Lay on the floor with your feet flat and knees bent. Raise one leg off of the ground, pulling the knee to your chest. This will be a starting position. Execute the movement by driving through the heel, extending your hip upward, and raising your glutes off of the ground. Extend as far as possible, pause, and then return to the starting position. So the fourth phase of the rehabilitation program is the sport-specific function phase, which goal is to return athlete to play. Return to sports is possible once pain is well controlled and the athlete has full knee movement with good strength, power, and balance. Knee braces may be recommended after the injury. Work towards full range of motion in the affected knee compared to the unaffected one. Full strength of the unaffected knee compared to the unaffected one. Also, work towards jogging straight ahead without pain or limping. So for the sport-specific function phase, I chose soccer. And so for the exercises, first I have dribbling drills, which includes long rotations with the ball at the feet, short rotations with the ball, and quick, sharp turns with the ball to both left and right sides. So for the second exercise, I have open lateral zigzag runs. Includes endurance based with long turns, gradually reducing distance between, and increased number of turns and increased speed of turn. And for the third exercise, I have 45-degree cuts, first at half speed, then at full speed, and I included a link showing this exercise. And here are my references, so that concludes my project on the medial collateral ligament sprain. Thank you.